Hello, welcome back. Welcome to the end. Our final lesson here on drugs. First thing, talk about what a drug is. A drug is something that affects the function of living things. And so this is something that's going to change. So, is sugar a drug? No, sugar is not a drug. Sugar is a nutrient. Sugar doesn't affect the way that your body functions. And drugs are more than just drugs, illegal drugs, or recreational drugs. We have drugs that relieve pain, treat certain types of illnesses like cancer and heart problems. And in general, certain drugs improve the state of health and well-being. Let's start with the non-steroidal anti-inflammatory drugs, also known as NSAIDs. What these are anesthetic, which means they relieve pain, antipyretic, pyro is fire, anti-fire fever reducer, and anti-inflammatory reduces inflammation. Aspirin, ibuprofen, and naproxen, these are examples of NSAIDs. These also are anticoagulants, so meaning that they will prevent your blood clots from forming. So these generally not given after surgery because surgery after someone's been cut, you want the clots to form. How they believe that they work are inhibiting what are called COX-1 and COX-2 inhibitors. And the general idea is, so COX-1 is associated with your stomach and COX-2 is associated with inflammation. So let's say you injure your arm and your elbow, for instance, you injure your elbow and then your body is said to release COX-2, which tells your body that it's time to swell up. So a COX-2 inhibitor blocks that signal and prevents the swelling from happening. And if you haven't noticed, we don't really know what's going on. They're just seeing a general idea. And there are some plain old COX-2 inhibitors. Most of the NSAIDs are COX-1 and COX-2 inhibitors. Some COX-2 inhibitors only are things like Vioxx. Vioxx is a COX-2 inhibitor. And acetaminophen, this is not really an NSAID because it's not anti-inflammatory, but it is an anesthetic and an antipyretic. This works by a COX-3 inhibitor. This blocks the pain receptor in general in your brain. One way to think of it is it raises your pain threshold level, is another way to think of it. Problem with acetaminophen or Tylenol, Tylenol is the therapeutic dose is relatively close to the toxic dose. And this is especially bad if you take it with alcohol. Here are some other things. So I talked about Vioxx and Celebrex. These are COX-2 only inhibitors. And the bottom ones, these are NSAIDs. So like ibuprofen, for instance, also Advil or Motrin IB or some brand names for that. Cold drugs, other types of cold drugs, antihistamines. So allergens, so if you're allergic to dust or mold, for instance, if you get exposed to it, your body triggers the histamine response. Histamine response are like itchy nose, itchy throat, and swelling. Antihistamines stop these histamines, and that blocks their response to it, so you feel better. Most of these cause drowsiness, except Claritin, Allegra, and Clarinex. And for my own personal thing, Claritin and Allegra do cause, they are general depressants, so be careful if you have to take these before a test, for instance. But if you can't handle the allergies, it's best to go with them. Certain other ones like Benadryl is an antihistamine that also makes one really sleepy. Cough suppressants. The way cough suppressants work is they numb the nerves around your lungs so you don't feel like you have to cough as much. Dextromorphin, that's found in certain cough syrups like Robitussin DM, for instance. Codeine is also used. The codeine is a prescription. Both of those are narcotics, but codeine is prescription, dextromorphin is not. Expectorant guaifenesin is the only expectorant on market. What guaifenesin does is it makes someone's coughs more productive, so you cough up more mucus with an expectorant. Decongestant, there are several. Some of them are steroidal, but the common one is pseudoephedrine. Things that are in Sudafed, for instance. These decongest, they're stimulants, and they decongest the nasal passageways. Antibacterial drugs, Before antibiotics and antibacterials were invented, the primary cause of death was infectious disease from pneumonia or something else, tuberculosis, these types of things. Since antibiotics have been invented, the primary cause of death right now is heart disease and cancer. So we die from the more slow diseases rather than the infectious diseases. These were first used in World War II. There are some allergies to sulfa, and there are other types of antibiotics. So antibiotics, this inhibits the growth of other microorganisms. So sulfa drugs, sulfonamide drugs, work by inhibiting vitamin B production, folic acid, and antibiotics. And we get our folic acid on our diets, but bacteria die from that. Penicillins, these work by inhibiting the cross-linkings of proteins around the bacteria. So the proteins coats around bacteria don't grow as well, and it helps your body to kill the bacteria. Other types, cephalosporins, Kerflex is one of those. That's commonly used for blood poisoning. Other types of like cellulitis oftentimes have Kerflex. Tetracycline. Why is it called tetracycline? Because here's tetracycline pictures on the right. There's 4 cyclic compounds on it, so that's the tetras, 4 cycling the cycle. Fluoroquinones, Cipro. Cipro is a fluoroquinone. Also, levaquin is another one, another type of fluoroquinone. Before I talk about antivirals, let me talk briefly about viruses. Viruses is a protein coat with DNA and or RNA. The more common viruses like influenza and rhinovirus, the one that causes colds, those have DNA as genetic material. Retroviruses have RNA, and common retroviruses are herpes and HIV, are both retroviruses. I'm going to talk about HIV a bit. HIV attack T cells, T lymphocyte cells. So what the T lymphocytes do is they direct other white blood cells. So it's kind of like if you have a parade. Imagine your immune system like a parade. So if there's a parade of people walking down the street, and if you go and you shoot the officer leading the parade, the rest of the people in the parade don't know where to step. That's kind of like killing all the T cells in your immune system. Your immune system doesn't work anymore. So HIV is interesting because it directly attacks the immune system and directly attacks a specific cell in the immune system. And so there's some antiviral drugs for influenza. There's Simitrel. Zovirax is for herpes types things. So chickenpox is actually a form of herpes. Of course, people think of herpes, they automatically think of herpes simplex 2, that's genital herpes. There's also herpes simplex 1, which is oral herpes, and there's other types, chickenpox, brownpox, smallpox, are also similar. They're also herpes viruses, but they're different types, and these can be treated with Zovirax. HIV, there's a couple of different types of drugs. There's nucleoside analogs. These replace the nucleosides AZT or azithromycin. That replaces thiamine and slows down DNA replication because a retrovirus needs to convert its RNA into DNA, and nucleoside analogs go after that step. Also, reverse transcriptase inhibitors like Rescriptor, this keeps new viruses being made. So when HIV or any virus infects a cell, it takes over the cell and turns that cell into a virus manufacturing plant. And Rescriptor keeps new HIV viruses from being made. And then protease inhibitors, these keep the viruses from infecting other T cells. And Noravir is an example of a drug that does that. Cancer drugs. So cancer is caused by rapidly dividing tumors. So let's say I have brain cancer, and why brain cancer is damaging, there's 2 reasons why. Because you have a tumor that grows really fast. First of all, it draws nutrients from the other tissues, and secondly, that as that tumor is growing, it puts pressure, physical pressure on the other areas of that tissue or adjacent. And so for instance, one can take an anti-metabolite that slows down metabolism. Now, the problem with taking anti-metabolites is that it slows down other rapidly reproducing cells like hair follicles and stomach lining. So that's why people that undergo chemotherapy have trouble with hair falling out and also gastrointestinal problems. Also, another problem with anti-metabolites, so if you or someone you love is taking these drugs, if you get bruises, they're a lot more slow to heal. So your body has a harder time healing after being, like for something as simple as a bruise. So be careful if you take those drugs to limit your activity. Don't go and play soccer, for instance. Alkylating agents, these cross-linked DNA strands, a common alkylating agent is cisplantane. The mustard gas, the chemical weapon, is also an alkylating agent. So actually, alkylating agents can cause cancer, but they can also treat cancer. It just depends on which agent you're using and the concentration. Hormones, so we talk about other drugs. Let's talk a little about the endocrine system. Endocrine system is the chemical center, chemical controls in your body. It regulates many processes. For instance, the thyroid gland, by secreting the hormone thyroxine, regulates your metabolism, which is kind of like your idol. And so some drugs are given to regulate these hormones, like for thyroid gland or other types of parts of your endocrine system. In birth control pills, the way birth control pills work is they make a female's body think that it's pregnant by adding progesterone-like molecules in the body. Also, for heart drugs, there are a couple types of blood pressure lowering. One is a diuretic. A diuretic will lower blood volume. This is especially important for people that have congestive heart failure. That's when your heart's not strong enough to pump the blood through. Beta blockers, the way beta blockers work is they reduce the force of a heartbeat. If you or someone else you know is taking a beta blocker, what beta blockers also do is they prevent. It would be hard, for instance, to sprint or to lift heavy weights with a beta blocker. So be careful with that. Calcium channel blockers, these relax the blood vessels, and ACE inhibitors, these keep blood vessels from contracting. So these all will lower the blood pressure. Drugs can also be used to normalize the heartbeat. And I'm going to talk about neurological active drugs. So let me talk a little bit about nerve cells or neurons. To the left here you see a neuron, and it has the nucleus on the end, and then the dendrites up there by the nucleus. And then there's the axon, which runs along the body, and then at the end you have the nerve ending, and between the nerve cells you have synapses. So on the right here is a blow-up of a synapse. A synapse is a gap between the nerve cells. And the nerve cells work by firing. The signal goes along the nerve cell, and then the signal is carried between nerve cells by neurotransmitters. And so let's talk about the psychotropic drugs, the ones that affect the mind. In general, stimulants, they excite mental processes. Depressants dull consciousness. Make people more relaxed or feel down lower. And hallucinogen will alter the way someone perceives things. And a very common use for psychotropic drugs are for anesthetics. Originally, diethyl ether was used as the original anesthetic, and it was from a dentist. A dentist went to an ether party, was inhaling ether, he got high, and afterwards he thought, you know, if I did this to my patients, they wouldn't really bother my patients if I ripped their teeth out. And so he used ether on his patients. Then chloroform was used. Neither of them are used really anymore. Also, local anesthetics, these numb a specific area. So lidocaine is very commonly used for that, like when you go to a dentist and he injects you and then dental surgery is done. Numb a specific area. A general anesthetic makes people unconscious, so knocks everything out. Local anesthetics, they are short-lived. We don't entirely understand the process of them. We believe they work by dissolving the areas around the nerve cells, around the synapses, so that the signals can't travel from one nerve cell to the other. So we're not entirely sure, but we believe that's how they work. and it's usually a hydrochloride or picorate salt to make them more soluble. Originally, Novocaine was the first one used, but that's no longer used. Typically, lidocaine is what's used, so even though people call it Novocaine, it's really lidocaine. And that's also tied with epinephrine to make the blood vessels carry the drug throughout the system a little bit more. And here are some of those local anesthetics, the chemical structures. And dissociative anesthetics, the way these work is they dissociate the perception from your sensations. And two well-known ones, ketamine. Ketamine works by, well, it's an animal tranquilizer, and it takes away perception. So if you give an animal or a human ketamine, if you start say like doing surgery on the animal's leg, the animal will not be able to connect the perception of the surgery with the sensation, what's going on. Also, PCP, or phenaclinidin, this is a dissociative anesthetic. Problem with PCP is it's fat soluble, so your body can't store it, and then later on, when your body releases or burns the fat, PCP can go back in your system, and this can cause what is commonly known as flashbacks, where the person will feel the drug's effect days to longer after the person has taken the drug initially. And this is a dissociative anesthetic, so the person will not really understand the perception with sensation the individual is feeling. Depressant, the largest consumed depressant is alcohol. Alcohol is these are all dopamine agonists, which mean increase the amount of dopamine neurotransmitter in your brain. And in general, alcohol is high in calories. It also keeps fat from being oxidized. That's why people get beer guts. They get the fat layers around their stomach, so that's from the alcohol keeping the fats from being oxidized. Alcohol appears to be healthy in small doses, but we really still don't entirely understand what happens when we get drunk. We believe that being drunk is similar to being very, very, very tired. Barbiturates, these are things like sleeping pills and sedatives, and an issue with barbiturates is there's a synergism. A synergism means they amplify each other with alcohol, so do not take barbiturates with alcohol. Same thing with narcotics. Narcotics and alcohol have synergism. Narcotics dull CNS, central nervous system. The brain and the spinal cord is the central nervous system. These are highly addictive. Most of these are derived from opium. Things like morphine, codeine, and heroin are narcotics derived from opium, and also called opiates. There are some synthetics like oxycodone and hydrocodone that are narcotics. And here are some of the chemical structures of those narcotics. You can see the chart here shows the different strengths of these narcotics. Stimulants, so these excite mental processes, and let's talk about amphetamines. Amphetamines like methamphetamine, a street name ice, these things greatly stimulate the brain. Cocaine, caffeine, and nicotine are also stimulants. As you can see, cocaine, well, some cultures still use cocaine. Cocaine is also a street drug. Caffeine is a stimulant, excites mental processes, as does nicotine. But nicotine also attaches itself in between the synapses of cells. Psychedelic drugs, so these are also hallucinogens. Lysergic acid diethylamide, also known as LSD or acid. Psilocybin, which is in mushrooms, or mescaline, which is in peyote. These types of drugs, they change the way we perceive things. So the way humans perceive are altered, and then that's why they're called hallucinogens. Cannabis. Cannabis is a hallucinogen. Marijuana is a cannabis plant. The active ingredient that is tetrahydrocannabinol, and cannabis, it coats the neurons, coats the nerve cells. So some people that take cannabis report a distorted sense of time and decreased pulse rate and impaired motor function. This is in part due to the THC molecules coating the nerve cells. And this is also why people, this is part of why, so people that are chronic users of cannabis have a very hard time with local anesthetics. They don't work as well because of the coating of the cannabis on the nerve cells, and we believe that they work by dissolving those areas. The cannabis prevents that. So if you are a habitual user of cannabis and you go to the dentist, don't expect to feel pain relief from lidocaine. Too much cannabis can lead to amotivational syndrome, which means basically people sort of lose motivation, tend to not want to do as much. Also, cannabis can cause, there's estrogen-like compounds in cannabis which can lead to feminization of males. Primarily, it can cause men to develop breasts. So that men have mammary glands, we just don't have enough estrogens to develop breast tissue. But given the right concentration of certain molecules, can lead to the development of breasts, and cannabis has those molecules in them.